All right, Phil, thank you very much. A recent survey from the CDC shows nearly 65% of women between 15 and 49 reported using some form of contraceptive.
And while there are plenty of benefits of hormonal birth control methods, little is known about their potential side effects. And here to talk about that is Dr. Sabrina Fabi. Thank you for joining us. Let's talk a little bit about how does this work. We're talking about pills specifically.
Yes, the ones that release some form of estrogen or progesterone. And so what this study found was that oral contraceptives are the second most common form of contraception in these women that were surveyed between the ages of 15 and 49. And 65% reported being on some form of contraception. The most common being tubal ligation, which is surgery. But what they looked at was that the group that is really taking this are primarily between the ages of 20 and 29. And then the second most common group is between 15 and 20. And so there's concern that if our brain continues to develop up until the age of 25, that hormone may have an effect.
So what are some of the potential benefits or side effects that we're learning about?
Yeah, so we know that we obviously have the benefit of preventing an unwanted pregnancy. And we also, sometimes even in dermatology, recommend people consider it to perhaps improve their acne. And we know that long-term there could even be a benefit in overall endometrial cancer, ovarian cancer, certain forms of cancer. For those who have heavy periods, that can also help so that they don't bleed a lot, they don't go through a lot of cramping, so there's definitely a benefit. But some of the potential side effects that we've always known is that if women have a history of migraines, it can worsen their headaches. If they have a history of clotting diseases, it can absolutely put you at risk of a clot. And if you smoke and you're greater than the age of 35, you're at even greater risk of that and even a stroke. So those are common side effects that we do know about.
Well, you said that the group that is using it are, the teenagers.
Exactly.
They're growing. And I know for a lot of women, the contraceptive pill oftentimes doesn't work for everybody the same way because they are hormones.
Exactly.
But does that affect development? I mean, as you're growing up?
Right, so there are 3 studies that really kind of highlight that there might be a potential implication. One of them was published in 2016 where they looked at folks that had been on the contraceptive pill since they were in adolescence. And what they found was, this was a Danish study that was done, if you followed them out in a group of 1 million women, there was a 23% increased risk of that person developing clinical depression at some point of their life, even if they discontinued it. But the more recent paper that came out by someone in Texas, the psychologist in Texas, showed that we know that estrogen has an effect in who we pick as a mate, overall mood, our motivations, how happy we may be. And so the thought is, since it has this effect on the brain, if you're on it for a long period of time or if you're on it in adolescence, could it have an implication? And so the most recent paper came out August of this year, showing that they looked at people that started the oral contraceptive pill in adolescence, in adulthood, and those that never started it at all. Those that had started it in adolescence had a significantly greater risk of having clinical depression later on in adulthood.
So when it comes to anybody who's either using it or considering using it,
Yes.
what do they need to know? What should they ask their doctor?
Right, so I think that it's good to know that it could have a greater implication than just improving acne and potentially your overall menses. And that if you have a history of depression, maybe clinically in the family, that if you perhaps may want to take a diary and note if you have a change in your mind and mood while you're on the pill, and make your doctor aware, and also know about the other potential contraceptive methods you can use, because this is not the only one.
Important information. Thank you so much, Dr. Fabi.
Thanks so much for having me.
We'll talk to you soon.